Hello, Harry Brownlow, shoulder specialist. Today I'm going to talk about the issues regarding consent for shoulder stabilisation. So you'll be having this operation because you have a problem with your shoulder dislocating or partially dislocating. And the issues I'm going to cover today are broad and non-specific, and it's really important that you take the time to think about these and then talk it through with your own surgeon, because you may have specific issues that relate particularly to you that are really important to be considered in your personal circumstances. So in broad terms, for a shoulder instability operation, I think the first thing I would discuss is the risk of the operation not working. So there's no operation that comes ever with a cast iron guarantee, and no surgeon could ever promise with 100% certainty that he's going to stop your shoulder ever dislocating again. And if you're a young guy and you like involving yourself in high-speed collision sport like rugby, then I'm afraid there is a risk that the shoulder may dislocate again, even if the operation and all the rehab goes absolutely perfectly to plan. So overall, in general terms, the risk of you having a problem with the shoulder continuing to dislocate is of the order of about 10%, so 1 in 10, although it may vary depending on your particular circumstances. And if you are in that unlucky group who goes on to redislocate, nearly always there are other operations that can be considered as revision procedures to stop you dislocating. The next and very serious complication to consider is that of infection. Now, luckily, the majority of stabilisation operations can be done through keyhole surgery, which means actually the risk of developing a deep infection is pretty small. It's probably less than 1 in 100, so less than 1 in 1%. But if it happened, it would be awful. It would undo all the good that was done in the operation. You may very well need several further operations to correct it. You would probably need prolonged periods on antibiotics and possibly a prolonged period in hospital. So although it's uncommon, if it happens, it can be very serious. And so it's worth bearing in mind. The other uncommon but important complication is the risk of injury to a nerve around the shoulder. Now, with keyhole surgery, generally speaking, we're fairly well away from nerves. We know, of course, where they are and we take great care. So the risk of causing serious permanent damage to a nerve is very small indeed. But, of course, if it happened, it could be very serious, permanent, and a source of great regret for everybody involved. A less severe and a more common complication is that of stiffness. Once you have an operation on your shoulder and we put you in a sling for a prolonged period, maybe 6 weeks, it's almost inevitable that the shoulder will have become a bit stiff, and time and physiotherapy will address that. But some people develop more significant stiffness, which is much slower and more resistant to treatment, and we call this a post-surgical frozen shoulder. Now, there are treatments that can be done in the form of further minor surgery, but most people choose not to have that, confident that in time the body just sorts itself out quite naturally. So that's it. Those are the main complications to consider. That's failure, infection, nerve injury, and stiffness. Thank you. So it may be that you're considering having an operation called a Latarjet procedure. It's named after a French surgeon, and it's a more advanced operation that's done in circumstances where there is recurrent instability but also associated with significant bone loss on the socket. And we build up that loss of bone by taking off a bit of bone from the front here, which is part of your shoulder blade called the coracoid. We cut it off, move it, and pin it into the area of the socket where you're missing bone. Now, some surgeons can do this operation with keyhole techniques. Personally, I can't, and I do the more traditional open style of surgery. It's a bigger operation than for a normal, straightforward stabilisation, and the risks are higher. So there is a bigger risk to nerves, and in particular there's one nerve that runs very close to where we're moving this bit of bone, and if that gets damaged, it can cause problems with activating your biceps muscle, which for some people can be a big problem. Thankfully this injury is not common and it's seldom a permanent thing, but it's certainly something to bear in mind. Also, because it's being done as an open procedure rather than keyhole surgery, then there is a slightly higher risk of infection, and because the piece of bone that we've transferred needs screws to hold it into its new position, the insertion of foreign material does also increase the risk of infection. But still, the overall risk of infection is probably of the order of about 1%, so only 1 in 100. So there's a 99 out of 100% times out of 100 infection will not be a problem. If you do get an infection, that can be a serious problem. It might require return trips to surgery, undoing all the operation that's already been done, and prolonged period of antibiotics, and can be a real misery for everybody involved. And finally, because it's a bigger operation, there is a higher risk of stiffness. But as with the more straightforward arthroscopic version of stabilisation, this stiffness will usually resolve itself with time and physiotherapy. Also to be considered with the Latarjet procedure are problems with this transferred bit of bone not healing in its new place, what we call a non-union. If it doesn't heal in its new place, that can be a source of pain. It can be a cause for the screws that were put in to break, and it can be a cause for your shoulder to start to dislocate again, so failure. And the other thing to bear in mind with this Latarjet procedure is that there is an association with developing osteoarthritis later in life. Now, we're not terribly clear at the moment whether the risk of developing osteoarthritis is simply a reflection of having numerous dislocations of your shoulder, and we currently believe that is the case, rather than a direct correlation to the operation itself. Thank you.